Naharolgi Akhanaba thorom tabiriba singbu taram nokcheri. Nasigi thorom de thamjeri World Suicide Prevention Day ga mari lenena sandokchaba Akhanaba thorom. Thorom lanthokcheriba malemgan mayumnam. Hozilobirasi Naharolgi Akhanaba thorom. World Suicide Prevention Day ga mari lenena koina nasi sandokcheriba nahasingda suicidal tendency lakpa haiba hiramsigi matangda koina mari sanajariba si Dr. Jina Heigrujam MD Psychiatrist Thoubal District Hospital da hujuji makbu biriba doctor ni hanba makta da koina suicide haibasi michum amagi loan da haiba tare kamaina define tawgani kamaina haigani aduga masigi oirakpagi maram singse magi causes singse kari kari na haiba doctor degen dang khangje
suicide haise intentionally isana bodily harm tawdo that is called suicide suicide ki reasons am like reba suicide can be again adults na tawar suicide is very different from adolescent and tawwa makha and suicide ki reasons say it could be because of mental disorder yamna makhal matel gi mental disorders yam like suicide yamna tawhanba or adum tawbada oiraise depression is one of the main cause of suicide and followed by other severe mental disorder schizophrenia and bipolar affective disorder kainam like sigumba mam sina suicide ki causes oiko and drug use is also one of the reason drug use ki sina reason say it's on rise NCRB gi accordingly desu in the last decade suicide yam thina rise tawkre and there's about like a 40% rise on suicide and suicide say adults ki and adolescent ki different yam like adolescent mainly drug abuse is one of the reason cause suicide tawbagi and then adolescent and childhood depression this is also one of the reason cause suicide yamna tawnaba angang singna suicide say fully completed suicide haibam sulai and there are many other related to suicide parasuicide behavior haiba deliberate self harm haiba shigi shuyam like when we say parasuicide haiba kanda not amounting to death shiba makti oiba natrasu but ishaba sokhanjaba to an extent that the person may not die adudadi shiba ni nataba but harm di muk laibado bodily harm tawbado ko adugumbado parasuicide behavior haibam like and there's something called deliberate self harm haibam sulaiba deliberate self harm haibse you see it in kids hujikan angang dasu ahan dasu interact over kanda marak adum thengna bane khatang impulsive oiba angang khitang what aggressive oiba entang unstable oiba kanda khudang daga blade na kakpagi ko these are the signs ko moina these few signs moina hana parasuicide tawba or deliberate self harm labor ma'am say these are the indication that one or the other day if interventions in a marak properly matang chana intervention tawhodragadi suicide attempt tawba haibado it's not it won't come as a surprise dumain tawbada
hojik takpiri sida adolescents ki makhal haiba tare society mawong siga ngasai gi adagi adult sing sigi sumu kitang khena bai mawong ama takpiri ado marui na khoina youth to focus tawjaba program ama oibani na drug ka mari leina ba society ki cases mayam ama hoje khoina yamna toina tare ise masida intervention ama tawbasi yam tangai fadaba leibra na khale do family gumbana masida kari role sing lobi ai magi peer friend circle sing na kari role sing lobi ai adugi matana ju takbi
yeah so kamai to ga the drug abuse lak pakan se one time use na drug abuse ti oiro ko one time use tagi nangonda check to lai haudraba kanda angang do family members no oire ko thadorak pa kanda phajana mama mapa na properly monitor tawdabado angang sigi growth se ingchandabado ko adum kanda moina drug abuse tawbaje hendale ko on top of that adu dangna tana broken family de lakpa mama mapa adum khanara leiba father alcoholic ka oiba yu dum nungti gi thakpa adagi mama abuse tawba urakpa shungma myam se shungma broken family de lakpa angang sina su dum tawbasu hengalle and chances se wange ko on top of that mogi friend circle se ado angang na magi peer ga pundagai ahan singa pulakpa ko ahan singa pula akanda exposure do ahan ga pulakpani na exposure do hena yama ani chahi ga chana da pote exposure to helakpa ko adugumba da lakpa kanda angang ni oirimni na the minds are very young they fresh duna anauba pot adum try tawning budo harm duna kayam kam karam extent ta moida kam shoki du di khang da bida adum di try de dum tawning ba another one time use second time use for example heroin use kumba tawba kan se adum by hook or crook paisa dum thiraga ko gari dagi bo thau chingthoga yolaga ko adumaina tawraga drugs to phangnabagi damakta to that extent moi je chatpa ngameba moi the control ama khak yaw hogdaba kando. So what happened is adumain tawrani plus family atmosphere duna keno tawrpa kanda angang adumaina tawbai not all angang loimak adumain tawbanate khara khak moi gi personality trait ta khitang unstable oiba ko cluster B kind of personality hai lairi ko little dramatic oiba khitang unstable oiba personality dadi impulsive act na self harm oiba act tawgiba moina tawriba self harm se they more intention to the sirage na khalagi dinataba ko pain inflict taunabagi khatangda to get attention ko adumaina tawgiba kandida moigi modus operandi do kayam thina moina tawriba act to kayam thina lethal oi di khangdabida that's adum sikhabasu phanayam yaweba angang singsigi marakta
attention seek tawnaba khak tawruraga
attention seek tawnaba tawruraga adugi attention seeking oiba behavior duna eventually dum life ta logibado adugumbasu yam yawe. And then even alcoholic to so alcoholic to moigi impulsive oiba se hengat leba alcohol dependence lak pakanda di aduna di risk taking behavior dum tawrani drugs na the noina drugs to pirak moina drugs to use tawba kanda di masaduda kiba kai ka phawra aroi adu phawra amnina dum risk taking behavior adu step to laukhala ani adaidi dum without them intending to die adum act to na dum even moina act to minor ne andi khanba but soidana singli sibasu phanam yawe ba ko adu so yam yawda banate
aduga hozik takpi khibada yamna maru oiba reason sing sida khoi mental health ka relate to pot me ama takpi khi depression anxiety bipolar tongan ba me am se do sigum bagi matang se lakpa matam de khoi na ngasai gi mental health ka related oiba suicide sing sida di khoi gi tangai fadana intervention amadi yamna nganna chatha hobada ka oibra na khale kana guma ma depress oirakpa matam da na tragana ma se kitang mangonda nungai ta ba kaino ma urakpa matam da timely intervention se amna tangai fadabra na khale to sigi matang de doctor na kai haibini.
Yeah, so timely intervention se darkar oi kai gi noida khoina mi tinaba imanabi marak to oigera ko colleagues marak to oigera mokhoina amu hairak pa yawe ba ko hairak pa su yawram gani noi gi marak to oisu ko ai thawai nungaite ai chaning ba phaude tumba yade ko matam kharagi 1 week or above ko amaina tawe khole isa je bit kam to yawde sining ba ma yawe hinga kai kana doino kaina khalle ka haibe me ma'am sina sum haiman gi dana because hujikan se mi se khitang stress handle tawnga maktaba kan de hekta issue ba je sat ana haiba sare kain ga haiba do sumaina haiba kan se da depression se trivialize ta weba yamna pick pa oina khana ba do but there are actually people who are suffering from depression and who needs help adu moi gi help se it's a teamwork again ko but before coming to the teamwork mokhoi gi circle the life with family or friends moina hana sigi change of behavior se urakpa kanda ko as a friend as a family kari tawre khole tana sira doctor tana sira either a psychologist or a psychiatrist ko amaina tanara matungda medication at the same time psychologist ko counselling tawraga that should go hand in hand adumaina it should go hand in hand so that the person reap maximum benefit out of it adumaina tawraga na a lot of suicidal thoughts meaning suicide act mako aina ngasai haijagibedo deliberate self harm na khudang ka aga para suicide behavior adumak yaw na extent yaw dresu mi ma'am se suicidal ideation leirapa yawe ba depressed over patient ta death wishes ka yaw ko suicidal ideation leiba kando mokhoi do if we intervene at the right time psychiatrist or psychologist ka hand in hand chatmi ra kandadi adugi ideation do counselling phajana pibi raga medication phajana pibi raga ko handa hanbado then depression comes down adaidi makhoi gi suicidal thought also comes down mathanda eventually it comes down aduga adum kaino tawbodo you can save someone if intervened at the right time you can save someone I do believe ki suicide is not a business of psychiatrists or a psychologist. I think it's everyone's business. Loimak na family members also, friends, everyone, teachers,
peer partners.
Exactly.
psychiatrist amagi manakta nataga psychologist amagi manakta purakpa haibasisu magi naknaba relatives oiro family members sing oiro moigi achoba role ama leiduni maramdi masado di depressed oiraga leirabani na mana di kaisu adugi initiative to di laura roina natra aduna family members sing asu kitang proactive oiba amakak yamna tangai fada braina khale doctor nozik thambi khibasida amuk makhata na lakchaning musu doctor akoina miyoi ama suicidal tendency yamna leire ena khanglapam akoina habdi ngasai tongan ba mong sing da mana suicide ki attempt sing torokpa natragan angang sing na khoigi kaino magi apama ma phangnabagi damakta khoigi magi attention seeking kaino haitare ko ek oina khoi khudang da kalakpa natragana kaino masa mathanda sohanna ba hona jarakpa matam sida masida kari family member moina parents moina natraga magi friend circle moina kari tahuba yai aduga kana tana ba yai madugi matang su kitang pangi
aigi my professor ko aigi guru haitare ko mana khoida dum haigibam leiba ko suicide is a cry for help. It's an act of despair. It's a disease of hope and I very much believe in that. Mokhoina adugi act kumbado taurakpa kanda akhoina uba kanda ko deliberate self harm da bo oiro ko khudang kakpa da oiro or hairakpa kanda ai sigrani adu torani adu hairakpa kanda I think everyone can spare at least a minute or two. Make them sit down phamda halaga kai nungai taba no hairo on habdo ventilate to ba habise phunjal laga mangonda nungai to am do phajan phunjan gai sum le kana da haidok to no khanda ba yum da oiro mama pa na ai adu thawai nungai te habda importance pan pi da badu ko because kanogi mental health ke awareness se khitang su comparatively to other health problem dadi khatang di less oi hujik pudi hengale ko but ha atai myam ga yeng nora ga di khitang ju less oi bani na ai thawai nungai te haiba ga ai puknai haiba ga doctor pukhalak se ai puknai haibdu na pukhali e ba ko thawai nungai te thawai nungai te ha di kaino ma chaw ro kaino asai pole ro thu ro hairaga dum lotion gi basu ya oi ba minute ama ni ko spare tok thoga just make the person ventilate mai nungai tabdo karino haina ventilate out to hon bado it's like kino do nai chabaga chamane ko pin na chakana thin bakanda na araga o malai bado mathanda chakana you like kino ignite chatana na ko pin na chakana thilura kanda mai pas myam thoglak bado aduga ma na bado phaidana lum bado ko it's the same as that mi amana phunjalaga phajalaga lai bado mangonda ventilate to haladi mangonda khara nungai bam su yauro ko problem duma thangda doine ba it might work for some time aduna well adugi one time ventilation few minutes ventilation duna kaino tawra roi ma he's like cured of depression di haibana taba but at least for that momentarily magi few magi thought to na yamna unsettled oiba matam dudi when you let them ventilate out when you know that when you make them feel that ko kananomna magi mana ngang doi wado tabi na ba lady habato adugi secure feeling do leiba kanda
extreme step to the lower
adugi step to the it reduce very much on the very
adugi wari sanabagi room duma leiraga de khoina professional amagi manakta chalaga tanaraga su natraga mana pami si kaino ama khangdokpagi achouba chance amadi mana pirakadoi neba yam chumi aduga makhatana lakkaning basi khoina manipur gumba state amada haijaba tare aduga nahagi population adum khoina yamna wangba aduga huji se khoina yamna kijari basi manipur da leiriba khoigi drug ki scenario sisu yamna kari haigani kiningai oiba masak amada leibani na masina maram oiraga ngasai drug kamari leinaba society case mayam ama reported aduga unreported cases mayam ama khoina adum personally thengnajaba aduga khabar kaga sing de khoina thengnajaba mayam asu leirakpanina asigumba mayam si hanbada khoigi kari karam miyoi sing haijaba tare ko parents tagi hauraga school college sing da adagi healthcare providers sing da makoi gi role sing se kamai na lei na khali kari tawhaning ba lei adu government gi side tagi kari policies gumba semaning ba dugumba gi wakhalon thambi
so adugi moi gi drugs abuse ki matang da ko angang sing na school da bo hairo ko oja dagi han hauraga awareness se oja dagi han hauba tare dagi kaigino the maximum time angang dunadi adolescents sing na spend tawri school da ne oire ko moina yum dagi haugatlaga school chakhraga halakpa matam dudadi warani potharani parents ka time spend tawse adolescent age tadi ozaga compare to the comparatively very less oina khalibuko ana akhoi as a healthcare professional akhoina mental healthcare professional akhoina teamwork of psychiatrists psychologists then social workers na akoina program gumba sembiraga school da chatlaga ko every district ki ore school da chatlaga awareness program oja sing they explain tawba how to spot someone, how to spot a student drugs use tawbada what could be their behavior changes ko hana lerambadagi what could be the behavior changes that they can see in them habado adu ma. And then for example depressed oiba child amna hana miga tinaramaga mathanda lainingakpa pangna pulaktaba dagi magi academic performance hantarakpa siguma mayam se. So we explain like oja sing du da shi tawni haidi oja duna understand tawradi moina first spot tawrakpa kanda obviously parents na hana inform tawdoine ana moigi treatment gap hai tare haurakpa du dagi treatment haudri bauki marakto telingoi phayeba handaligai matam do telingai phayeba ana ojada hana awareness takpado ko shine sumahin tawradi noi satisna shi tawradi report tawbiyo parents ta haibio haina adui matungda adugi from that channel oja aduge hauraga moigi PTA tawba kanda ko parent teacher meeting tawba kanda aduda mama parents sing duda dum oja sing jina haibi ki yare angang se sumain tawena amama one on one interaction da ko adu maina tawbam su da ka tain khale. And then from government's front I feel mental health ki da focus se khatang hena thada biraga ko if not like every district the mental hospital ama set up tawba it's a very far fetched dream adudi fujiki oina ko. But I think for our state, Manipur gi oina a mental hospital ama established over the I think it's mandatory because other hospital the mental gi wing yauri se ko psychiatrist wing yauri se the general hospital the attached to bane ba ko general hospital the attached to banina ward ka ju khaidorak pa kholak pa to ba kanda yamna violent oiba patient kumba yaurpa kanda di tongana makhoi gi oina thambadi natre dana amuk ko because it's like general oirapanina ko aduna adu mental hospital ama Manipur da that would be a big step and a very helpful step to all the people ko and people who are actually suffering from mental disorder and family members to oigera ko family members to ju yamna because family members amana any psychiatric disorder and adu maina deal to bahai se makhoi de su burden yam leyeba aduna maybe to reduce the burden also ko hai tare adu maina tawbudo that step is also I feel adugi shu adugi mal la adi adugi what do you call government na policy ma initiative ama lawradi it will help in great deal.
I mean how riba mental health professional amoina zik Dr. Jina na phongdo perli bo afom sisu yamna fazaba yamna kanagada bo afom mane ai khoina sulauze adu Dr. Jina loiselak pasida World Suicide Prevention Day ga mari leinana lamdam sigi miyam da haizaba tare hauzik thengnari bai khoina suicidal cases mayam suicide ki reported unreported cases mayam si khardor su handhana ba haiba tare general khoi thorom tabiri ba miyam sida kari wafam sing kari message sing thambini
anakta leiba mi sing ko family oigera friends oigera khitang nungaitaba phongdorakpa khitang intent suicide intent khatang utpa horakpa kanda machinna thokna hairakpa matamda ko yam laina lokthokpidaba adu moina ngangi do tabiba aduga help to aina ngasai haijagibedo ko minute amani tang oirsu ventilate out tongnaba ko this is for the large scale mayam da every time every nook and corner the psychiatrist laibadi na tamne na ko family the starts from the family and imung de angang amano oigera ahan amano oigera adugumbai acts to parasuicide or saigi makhut lenba deliberate self harm gumba tawba horokpa kanda or phongdorakpa kanda ai sininge kholinge hairakpa kanda line tarai na lokthokpidaba moina haido kari nungai tabale hena 2 minutes spare tawraga moina ngangi do tabiba adagi adugi matungina darkar tawraga adum psychiatrist adum anakpa any district hospital gumba da orgera adum pubira aga district hospital or rims jenims du leiko moi should adum pubira aga adum psychiatrist ka tanaraga and then like I said hand in hand with a psychologist adum tanaraga moi gi nungai tabado karino haibado adu vigilant oiba in simple words surrounding the if you are a little vigilant then it can be prevented. Suicide can be prevented. Khatang mitna singaga leibado ko nakan khoi nakan gi mi sing sina nungai tabase karino kholino angang sina imungi sina da imina nungai te ai si jagrai khut len ba kan da tarai na lokthok pidaba aduga khatang moina ngangi do kaino haina minute ani spare tawraga tabiraga ko adui health care professional ta pubirakpa adumain tawbiradi adum suicide can be prevented to a large extent.
Yam fazaba wafam maya ama Dr. Jina na thambiri Dr. Jina bungam khalitina thagachari.
Thank you.
From Sida Zimuk, Kuna Wari Sanajari Basi, we care counseling center, the counselling psychologist, Samo in the Liberiba, Thoithoi Wangkhem ni, Han Bamakta Daikuna, Thoithoi Counselling Basi. Me amana, Magi suicidal tendency lady, and a Kangbazi, Masi Kamaito or Kangani, Magi sign and symptoms, warning credit, Shoidana, Magi behavior, the Magi Pirakane and a Kalekun Upang and a Kale, the Karikari, Mawong Sing, Karibak and Osina, Mis in the Mushina Tauragadi, Madu, suicide, Torakadore, Natraga, suicide Toropayabagi tendency, Lae Hybaginosi, a Karikari in a Kangani to Tatapi.
Quiggy, me amana suicidal thoughts, Natraga, suicidal behavior. Thoughts high in a queen measure or important on a low with suicidal thoughts lakumatam, the miamana bakpak hena yamna line uber pang the vanina Karigumatam the Sukitang the Su sign, Hiba warning sign, Hibama, family members in Nikangde, Natramasada Nikangde, Utpakradi the Miawi, Adugi warning sign though a Makatana step by step in Hizerake. Ahama the Queen Yangada was a me Misak Aduna. Kaigumba wangang bada akogi masada hopeless feel tawjarappa wangang sangang yaurpa yai haidi punsije kashu oidre khotre ai kemta kanadre haiba masagi hopelessness haiba pot ama yaurae adagi mi duna masaje trap oina haidi ai je phajallaga thambugi mowongda oina khalakpa gumba yaurpa ko sigumba adagi mayamda family gi manung da su tillaga su mathanda hek tumin hek laibugumba ko loneliness gumbagi feeling se hek la pagumba puning da basi sigumba se si akoina khara yengba ma daka la yam important oina lawba phai aduga wari watai sana badusu kaigumba akoina life se kashu oidre I give up tawrage gaina hekta wari watai sumna wari watai sana badusu hekta hairak pagumba se masi akoina yam tarai ne lawsu yade adudagi akoigi personal harm hai tare ne ko akoigi sokpa yaba akoigi hek paisalaga thambagum akoigi phenyl gumba blade gumba thang gumba akoigi sada sokpa yaba gumba se sigumba tool akoigi mapot machak sing je koina paisanba gumba hek torpa gumba thori gumba se hek thiba gumba khotpa ko sigumba marmicha sadana sigumba se koina kitang important oina yengbam thoi aduga misak sina akoigi keno gumba akoigi tanja sadana akoigi hek duration yamna tumkhalakpa natraga sumtum tumaktaba sigumagi changes ama behavioral changes ama lakpagumba ko si akoina yengmam thoi adagi wakhal nuaitraga wakhal maje wakhal nuaitre handak marakse wakhal nuaite khote na hairaga kaigumba koigi alcohol gumba natraga drug consumption gumba torpa khotpa ko sigumba si akoina suicidal thoughts natraga behavior gi risk oibum kano nena khanba yai social interaction hai tare ne ko laikai gi natraga laikai gi di secondary ogre family gi manung da kai gumba thodo watu tholok matam da interact to bi da ko interact torok to matang yarokani dugumba ju yengba phai adagi matang cha cha dana saugat pa adagi irritate oirakpa sigumba su koina important ona lobi yai adagi dramatic mood swing hai je ngasaina kappaga natraga thawai nungai tana lembado khangudana hek nuwarakpa hek nokthokpagumba ko yamna chanadaba haibadare ko mood swing se ko adagi hafta ama mamang hafta se madi yamna thawai nuwaitana wari watai se yamna sad oiba mongda liramaga khangudana hek change hek torokpa ma yamna harau ta yamna wari watai sanarakpagumba changes gumba lerakpa je sidu koina kitang koina important oina koina lobam thue adagi wari watai sum sana matam tu ngasai aina panjagre society sina khata koigi solution ne hairaga masana wari watai sana bada he haidok sarap ko ko
sina tadu pilot
gain haibase sina khatang ne we ne gain haibase si akoina si is important logom thui adagi akoigina mamanabe sing natraga family members sing manungda akoina wari watai sana matam da ai ngasi dagi hayeng dagi nang una phangaroi gumba koigi wahi wata si ko si jene wahi wata se si akoina family members sing su yam important oina logom thui tarai na logum thokte
kanagumba miyoy mana ꯑꯩꯒꯤ ꯃꯤꯠꯃꯥꯡꯗ ꯅꯠꯇ꯭ꯔꯒ ꯀꯅꯥꯒꯨꯝꯕ ꯑꯃꯒꯤ ꯃꯤꯠꯃꯥꯡꯗ ꯑꯩꯒꯤ ꯃꯔꯨꯞꯁꯦ ꯅꯠꯇ꯭ꯔꯒ ꯑꯩꯒꯤ ꯏꯆꯤꯜ ꯏꯅꯥꯎꯁꯤꯡ ꯁꯤꯒꯤ ꯃꯔꯛꯇꯒꯤ ꯑꯃꯅ ꯑꯁꯤꯒꯨꯝꯕ ꯌꯥꯝꯅ ꯃꯁꯥꯅ ꯃꯁꯥꯕꯨ ꯁꯣꯛꯍꯟꯖꯕ ꯌꯥꯕ ꯃꯑꯣꯡ ꯑꯃꯗ ꯂꯩꯔꯦꯅ ꯈꯟꯕ ꯃꯇꯝꯁꯤꯗꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯏꯃꯔꯖꯦꯟꯁꯤ ꯑꯣꯏꯅ ꯀꯔꯤ ꯀꯔꯤ ꯊꯕꯛꯁꯤꯡ ꯂꯧꯈꯠꯐꯝ ꯊꯣꯛꯏ ꯑꯗꯨꯒꯤ ꯃꯇꯥꯡꯗꯁꯨ ꯈꯤꯇꯪ ꯇꯥꯛꯄꯤꯌꯨ.
Imminent danger ꯍꯥꯏꯇꯥꯔꯦꯅꯦꯀꯣ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯤꯠꯃꯥꯡꯁꯤꯗ ꯍꯧꯖꯤꯛ ꯄꯟꯕꯤꯈ꯭ꯔꯤꯕ ꯀꯩꯅꯣꯁꯤꯡꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯤꯠꯃꯥꯡꯁꯤꯗ ꯀꯩꯒꯨꯝꯕ ꯁꯨꯃꯥꯏꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯣꯁꯥꯏꯇꯜꯒꯤ ꯑꯦꯇꯦꯝꯞ ꯅꯠꯇ꯭ꯔꯒ harmful act-ꯀꯨꯝꯕ ꯑꯃ ꯊꯣꯛꯇꯣꯔꯦ ꯅꯠꯇ꯭ꯔꯒ ꯊꯣꯛꯂꯛꯑꯦ ꯍꯥꯏꯕ ꯎꯕ ꯇꯥꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯇꯧꯒꯗꯕꯁꯦ ꯀꯩꯅꯣ ꯍꯥꯏꯇꯥꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯌꯥꯝꯅ ꯀ꯭ꯂꯣꯖ ꯑꯣꯏꯕ ꯔꯤꯂꯦꯇꯤꯚꯁ ꯍꯥꯏꯇꯥꯔꯦꯅꯦ ꯑꯩꯈꯣꯏꯕꯨ ꯇ꯭ꯔꯁꯋꯔꯗꯤ ꯑꯣꯏꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯔꯤꯂꯦꯇꯤꯚꯁ ꯀꯣ ꯃꯣꯏꯁꯤꯗ ꯑꯩꯈꯣꯏꯅ ꯀꯣꯜ ꯇꯧꯕꯤꯕ ꯑꯃ ꯗꯔꯀꯥꯔ ꯂꯩ ꯀꯩꯒꯤꯅꯣꯗ ꯍꯥꯏꯗꯤ ꯃꯤꯗꯣ ꯌꯥꯝꯃꯒꯗꯤ ꯁ꯭ꯇꯔꯦꯡ ꯑꯃ ꯐꯪꯉꯤꯗꯅꯀꯣ ꯁꯄꯣꯔꯠ ꯑꯃ ꯐꯪꯉꯦꯕꯀꯣ ꯀꯔꯤ ꯇꯧꯒꯗꯕꯅꯣ ꯍꯥꯏꯕ ꯄꯣꯠꯇꯣ ꯑꯩꯈꯣꯏꯅ ꯇꯥꯟꯅꯔꯒ ꯈꯟꯅꯕꯒꯤ ꯇꯟꯖꯥ ꯑꯃꯁꯨ ꯐꯪꯉꯤꯀꯣ ꯃꯤ ꯌꯥꯝꯅ ꯌꯥꯝꯗ꯭ꯔꯒꯗꯤ ꯀꯩꯒꯨꯝꯕ ꯁꯄꯣꯔꯠꯇꯣ ꯈꯤꯇꯪ ꯋꯥꯠꯂꯤꯅ ꯍꯥꯏꯖꯔꯤꯕꯀꯣ ꯑꯗꯨꯅ ꯌꯥꯔꯤꯈꯩꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯀꯣꯜ ꯇꯧꯕꯤꯕ ꯁꯦꯀꯦꯟꯗ ꯀꯩꯅꯣ ꯀꯣꯜ ꯇꯧꯕꯤꯕ ꯂꯣꯏꯔꯒ ꯑꯩꯈꯣꯏꯅ ꯏꯃꯤꯗꯤꯌꯦꯠꯂꯤ ꯑꯩꯈꯣꯏꯅ ꯍꯦꯜꯊ ꯀꯦꯌꯔ ꯁꯔꯚꯤꯁꯀꯨꯝꯕ ꯏꯃꯔꯖꯦꯟꯁꯤ ꯍꯦꯜꯊ ꯀꯦꯌꯔ ꯁꯔꯚꯤꯁꯁꯤꯗ ꯐꯣꯟ ꯇꯧꯕꯤꯔꯒ ꯍꯣꯁꯄꯤꯇꯥꯜꯗꯅꯤ ꯈꯪꯗꯦ ꯏꯃꯔꯖꯦꯟꯁꯤ ꯍꯦꯜꯞ ꯂꯥꯏꯟꯗꯅꯤ ꯈꯪꯗꯦ ꯑꯩꯈꯣꯏꯅ ꯀꯣꯜ ꯇꯧꯕꯤꯕ ꯑꯃ ꯆꯪꯉꯤꯀꯣ ꯑꯗꯨ ꯍꯦꯜꯞ ꯑꯩꯈꯣꯏꯅ ꯍꯧꯖꯤꯛ ꯐꯣꯟ ꯇꯧꯔꯕ ꯃꯇꯨꯡꯗ ꯍꯦꯜꯞ ꯂꯥꯛꯇ꯭ꯔꯤꯉꯩꯒꯤ ꯃꯅꯨꯡꯁꯦ ꯃꯁꯤꯁꯦ ꯑꯩꯈꯣꯏꯅ ꯀꯩ ꯇꯧꯒꯗꯕꯅꯣ ꯍꯥꯏ ꯇꯥꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯍꯧꯖꯤꯛꯀꯤ ꯃꯤꯗꯨꯒ ꯃꯤꯁꯛꯇꯨꯒ ꯐꯦꯃꯤꯂꯤ ꯃꯦꯝꯕꯔꯁ ꯍꯥꯏꯇꯥꯔꯦꯅꯦꯀꯣ ꯑꯗꯨꯒ ꯐꯝꯃꯤꯟꯅꯔꯒ ꯋꯥꯔꯤ ꯋꯥꯇꯥꯏ ꯁꯥꯕ ꯉꯁꯥꯏ ꯑꯩꯈꯣꯏꯅ ꯍꯥꯏꯖꯈ꯭ꯔꯤꯕ ꯃꯃꯥꯡꯗ ꯄꯟꯖꯈ꯭ꯔꯤꯕ ꯖꯖꯃꯦꯟꯇꯦꯜ ꯑꯣꯏꯔꯣꯏꯗꯕꯅꯤ ꯑꯗꯨꯗꯒꯤ ꯃꯉꯣꯟꯗ ꯄ꯭ꯔꯦꯁꯔ ꯄꯤꯔꯣꯏꯗꯕꯅꯤ ꯑꯗꯨꯗꯒꯤ ꯃꯥꯁꯦ ꯍꯟꯊꯅ ꯌꯦꯡꯉꯣꯏꯗꯕꯅꯤ ꯑꯗꯨꯗꯒꯤ ꯃꯥꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯅꯪꯅ ꯇꯧꯔꯤꯕ ꯊꯕꯛꯇꯨ ꯃꯤ ꯃꯃꯥꯡꯗ ꯂꯩꯀꯥꯏ ꯃꯃꯥꯡꯗ ꯏꯀꯥꯏꯕ ꯊꯧꯗꯣꯛꯅꯤ ꯍꯥꯏꯕꯅꯆꯤꯡꯕ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩꯈ꯭ꯔꯦꯀꯣ ꯁꯤꯒꯨꯝꯕ ꯋꯥꯍꯩ ꯋꯥꯇꯥꯁꯦ ꯑꯩꯈꯣꯏꯅ ꯁꯤꯖꯤꯟꯅꯗꯕꯤꯕ ꯌꯥꯝꯅ ꯅꯣꯟ ꯖꯖꯃꯦꯟꯇꯦꯜ ꯑꯣꯏꯕ ꯃꯑꯣꯡꯗ ꯀꯦꯌꯔ ꯑꯣꯏꯕ ꯃꯑꯣꯡꯗ ꯁꯄꯣꯔꯇꯤቭ ꯑꯣꯏꯕ ꯃꯑꯣꯡꯗ ꯑꯩꯈꯣꯏꯅ ꯃꯥꯁꯦ ꯋꯥꯔꯤ ꯁꯥꯟꯅꯕꯤꯒꯗꯕꯅꯤ ꯑꯗꯨꯒ ꯉꯁꯥꯏ ꯑꯩꯅ ꯍꯥꯏꯖꯈ꯭ꯔꯤꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯔꯛꯁꯤꯗ ꯀꯥꯗ ꯅꯠꯇ꯭ꯔꯒ ꯌꯨꯝꯁꯤꯗ ꯌꯨꯝꯒꯤ ꯃꯅꯨꯡꯁꯤꯗ ꯂꯩꯕ ꯑꯩꯈꯣꯏꯗ ꯍꯥꯔꯝꯐꯨꯜ ꯈꯨꯗꯣꯡꯊꯤꯅꯤꯡꯉꯥꯏ ꯑꯣꯏꯕ ꯍꯥꯔꯝꯐꯨꯜ ꯑꯣꯏꯕ ꯌꯥꯕ ꯄꯣꯠꯁꯛꯁꯤꯡꯁꯦ ꯃꯁꯤ ꯑꯩꯈꯣꯏꯅ ꯌꯥꯝꯅ ꯂꯥꯞꯅ ꯊꯝꯕꯤꯈꯤꯕꯀꯣ ꯂꯣꯠꯁꯤꯟꯕꯅꯤ ꯈꯪꯗꯦ ꯍꯣꯏ ꯑꯗꯨꯃꯥꯏꯅ ꯇꯧꯕꯤꯕ ꯑꯃꯀꯣ ꯁꯨꯁꯥꯏꯗꯜ ꯊꯣꯠꯁ ꯅꯠꯇ꯭ꯔꯒ ꯁꯨꯁꯥꯏꯗꯜ ꯑꯦꯇꯦꯝꯞ ꯇꯧꯔꯤꯕ ꯃꯤꯗꯨꯅ ꯍꯥꯏꯔꯛꯄꯁꯤꯡꯁꯦ ꯑꯩꯈꯣꯏꯅ ꯇꯥꯕꯤꯒꯗꯕꯅꯦꯕ ꯑꯥꯔꯒꯨꯃꯦꯟ ꯇꯧꯕꯒꯤ ꯀꯩꯝꯇ ꯀꯥꯟꯅꯕ ꯐꯪꯉꯣꯏ ꯁꯤꯆꯨꯋꯦꯁꯟꯗꯣ ꯑꯩꯈꯣꯏꯅ ꯀꯟꯇ꯭ꯔꯣꯜ ꯅꯠꯇ꯭ꯔꯒ ꯃꯦꯅꯦꯖꯃꯦꯟ ꯇꯧꯕ ꯉꯝꯃꯣꯏ ꯀꯩꯒꯨꯝꯕ ꯑꯥꯔꯒꯨꯃꯦꯟꯇꯤቭ ꯍꯥꯏꯈꯤꯕ ꯇꯥꯔꯒꯗꯤ ꯑꯥꯔꯒꯨꯃꯦꯟꯁꯤꯗ ꯑꯣꯟꯊꯔꯛꯄ ꯇꯥꯔꯒꯗꯤ ꯑꯃꯁꯨ ꯈꯨꯗꯣꯡꯊꯤꯅꯤꯡꯉꯥꯏ ꯍꯥꯏꯕꯗꯣ ꯑꯗꯨꯝ ꯑꯣꯏ
ꯍꯦꯟꯅ ꯍꯥꯟꯅ ꯂꯩꯔꯝꯃꯤꯗꯨꯗꯒꯤ ꯍꯦꯟꯅ ꯁꯥꯎꯒꯠꯄꯁꯨ ꯌꯥꯏ
ꯍꯣꯏ ꯑꯗꯨꯒꯤ ꯌꯥꯔꯤꯈꯩꯗꯤ ꯃꯥꯅ ꯍꯥꯏꯕꯤꯕꯗꯣ ꯃꯤꯁꯛꯇꯨꯅ ꯍꯥꯏꯔꯤꯕꯗꯣ ꯇꯥꯕꯤꯕꯀꯣ ꯑꯗꯨꯗꯒꯤ ꯑꯥꯔꯒ꯭ꯌꯨ ꯇꯧꯕꯤꯗꯕ ꯑꯗꯨꯒ ꯃꯉꯣꯟꯗꯁꯨ ꯊ꯭ꯔꯦꯇꯟ ꯇꯧꯕꯤꯗꯕ ꯀꯣ ꯍꯥꯏꯗꯤ ꯍꯧꯖꯤꯛꯀꯥꯟꯁꯤꯗꯤ ꯑꯗꯨꯝ ꯇꯧꯕꯤꯗꯅꯀꯣ ꯅꯪ ꯁꯤ ꯇꯧꯗ꯭ꯔꯒꯗꯤ ꯑꯩ ꯇꯧꯅꯤ ꯁꯤ ꯇꯧꯅꯤ ꯑꯗꯥ ꯇꯧꯅꯤ ꯍꯥꯏꯕ ꯃꯌꯥꯝ ꯑꯃ ꯑꯉꯥꯡ ꯅꯠꯇ꯭ꯔꯒ ꯃꯤꯗꯁꯨ ꯀꯤꯍꯟꯕ ꯈꯣꯠꯍꯟꯕ ꯌꯥꯝ ꯌꯥꯎꯏꯀꯣ ꯑꯗꯨꯅ ꯃꯤꯁꯤꯅꯁꯨ ꯑꯗꯨꯝ ꯂꯣꯠꯁꯟꯕ ꯈꯣꯠꯆꯟꯕ ꯑꯗꯨꯝ ꯌꯥꯎꯔꯛꯀꯅꯤ ꯍꯥꯏꯗꯤ ꯑꯩꯒꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝꯁꯦ ꯀꯩꯅꯣ ꯍꯥꯏꯕꯁꯤ ꯃꯣꯏ ꯆꯩꯔꯛꯀꯅꯤ ꯅꯠꯇ꯭ꯔꯒ ꯑꯩꯉꯣꯟꯗ ꯉꯥꯡꯉꯛꯀꯅꯤ ꯍꯥꯏꯕꯒꯤ ꯑꯀꯤꯕꯗꯣ ꯑꯗꯨꯝ ꯂꯩꯕꯅꯤꯅ ꯍꯥꯏꯗꯣꯔꯛꯇꯕ ꯃꯌꯥꯝ ꯑꯃꯁꯨ ꯌꯥꯎꯏꯀꯣ ꯑꯗꯨꯒ ꯀꯩꯒꯨꯝꯕ ꯏꯃꯔꯖꯦꯟꯁꯤ ꯍꯦꯜꯊ ꯀꯦꯌꯔꯁꯦ ꯂꯥꯛꯑꯦ ꯅꯠꯇ꯭ꯔꯒꯏꯃꯔꯖꯦꯟꯁꯤꯗꯒꯤ ꯃꯤ ꯂꯥꯛꯑꯦ ꯈꯣꯠꯂꯦ ꯑꯗꯒꯤ ꯍꯣꯁꯄꯤꯇꯥꯜꯗꯒꯤ ꯂꯥꯛꯑꯦ ꯈꯣꯠꯂꯦ ꯅꯠꯇ꯭ꯔꯒ ꯃꯣꯏ ꯂꯥꯛꯇ꯭ꯔꯃꯛꯁꯨ ꯑꯩꯈꯣꯏꯒꯤ ꯐꯦꯃꯤꯂꯤ ꯃꯦꯝꯕꯔꯁ ꯑꯩꯈꯣꯏꯒꯤ ꯌꯥꯝꯅ ꯀ꯭ꯂꯣꯖ ꯑꯣꯏꯕ ꯐꯦꯃꯤꯂꯤ ꯃꯦꯝꯕꯔꯁ ꯑꯃ ꯂꯥꯛꯑꯦꯅ ꯍꯥꯏꯕ ꯇꯥꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯃꯣꯏꯒ ꯂꯣꯏꯅꯅ ꯍꯧꯖꯤꯛꯀꯤ ꯃꯤꯁꯛꯇꯨ ꯁꯨꯁꯥꯏꯗꯜ ꯇꯦꯟꯗꯦꯟꯁꯤ ꯂꯩꯔꯤꯕ ꯁꯨꯁꯥꯏꯗꯜ ꯑꯦꯇꯦꯝꯞ ꯇꯧꯔꯤꯕ ꯃꯤꯗꯨ ꯃꯥꯒ ꯂꯣꯏꯅꯅ ꯇꯧꯔꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯣꯁꯄꯤꯇꯥꯜꯗꯅꯤ ꯈꯪꯗꯦ ꯃꯅꯥꯛ ꯅꯛꯄ ꯄ꯭ꯔꯥꯏꯃꯥꯔꯤ ꯍꯦꯜꯊ ꯁꯦꯟꯇꯔꯗꯅꯤ ꯈꯪꯗꯦ ꯃꯅꯥꯛ ꯅꯛꯄ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯣꯁꯄꯤꯇꯥꯜꯅꯤ ꯈꯪꯗꯦ ꯆꯠꯄꯤꯔꯒ ꯃꯇꯦꯡ ꯂꯧꯕ ꯌꯥꯝꯅ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯑꯣꯏ ꯍꯥꯏꯕꯁꯦ ꯑꯩ ꯊꯝꯖꯒꯦ
ꯉꯁꯤꯒꯤ ꯅꯍꯥꯔꯣꯜꯒꯤ ꯑꯈꯟꯅꯕ ꯊꯧꯔꯝꯗ ꯇꯥꯕꯤꯈ꯭ꯔꯦ ꯋꯥꯔꯜꯗ ꯁꯨꯁꯥꯏꯗ ꯄ꯭ꯔꯤꯚꯦꯟꯁꯟ ꯗꯦꯒ ꯃꯔꯤ ꯂꯩꯅꯅ ꯁꯟꯗꯣꯛꯆꯕ ꯑꯈꯟꯅꯕ ꯊꯧꯔꯝ ꯑꯃ ꯊꯧꯔꯝ ꯂꯥꯟꯊꯣꯛꯆꯈꯤꯕ ꯃꯥꯂꯦꯝ ꯉꯥꯟꯕ ꯌꯨꯝꯅꯥꯝ ꯊꯧꯔꯝ ꯑꯁꯤ ꯇꯥꯕꯤꯈꯤꯕꯒ ꯂꯣꯏꯅꯅ ꯉꯁꯤꯒꯤꯗꯃꯛꯇꯗꯤ ꯅꯍꯥꯔꯣꯜꯒꯤ ꯑꯈꯟꯅꯕ ꯊꯧꯔꯝ ꯁꯟꯗꯣꯛꯆꯕ ꯃꯇꯥꯡ ꯑꯁꯤꯗ ꯂꯣꯏꯁꯤꯟꯖꯔꯤ ꯊꯧꯔꯝ ꯇꯥꯕꯤꯔꯤꯕ ꯈ꯭ꯋꯥꯏ ꯈꯨꯗꯤꯡꯃꯛꯄꯨ ꯑꯃꯨꯛꯀ ꯍꯟꯅ ꯈꯨꯔꯨꯝꯖꯔꯤ